Bismillahirrahmanirrahim. Assalamu alaikum. Imagine a condition so widespread, so insidious, that it quietly fuels type 2 diabetes, heart disease, fatty liver, polycystic ovarian syndrome, Alzheimer's, and even cancer. Yet it often goes undiagnosed in our own clinics. I am Prof.Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Medicine Made Easy. We are in the workshop on metabolic health, and in today's session, we shall explore insulin resistance, not as a lab value, but as a foundational pathology that connects seemingly unrelated diseases. If you are treating chronic illnesses without evaluating insulin resistance, you might be treating the fire without noticing the fuel. In today's lecture, we shall revisit the clinical relevance of insulin resistance, uncover why standard tests often miss it, and discuss what we as doctors must do differently in diagnosis, treatment, and prevention. Insulin resistance, the silent driver of chronic disease. You have two patients in your clinic today. Both have normal HbA1c. Both have normal fasting glucose. But one has fasting insulin at 18, triglycerides 8 to 20, and waist circumference creeping up. The other, fasting insulin of 5, normal lipids, and stable weight. One of them is on the path to type 2 diabetes, cardiovascular disease, and MASH. The other, likely metabolically healthy. Here's the problem. We only screen for glucose, not insulin resistance. And by the time glucose rises, it's years too late. Using commercial assays, normal fasting insulin level range between 5 and 15 microunit per ml. But with more sensitive assay, normal fasting insulin should be lower than 12 microunits per ml. So why insulin matters? Why insulin resistance matters? The overlooked epidemic. Insulin resistance starts 10 to 15 years before diabetes is diagnosed. 50 to 80% of adults with normal glucose levels already have insulin resistance. It's the root cause of most chronic diseases like diabetes, obesity, MASLD, PCOS, cardiovascular disease, even Alzheimer. It's rarely tested, rarely treated early, and often ignored. So, question for you: how often do you check insulin levels or HOMA-IR in your clinic? Drop it in the comments. The root cause: how insulin resistance develops. Insulin normal role. What's the normal role of insulin? It moves glucose into cells for energy. We know that. It regulates fat storage and muscle function. It supports vascular and brain health. So what goes wrong? Excess energy, high carb processed food diet, it leads to chronically high insulin. Inflammation starts, there's gut dysbiosis, and visceral fat worsens resistance. There is compensatory hyperinsulinemia, and it masks the problem, keeping glucose normal, while metabolic dysfunction progresses silently. So this is the issue, that what we see, the glucose, it's normal, but there is already insulin resistance set in. So a clinical challenge: a patient has normal fasting glucose, but high insulin HOMA score more than 2.5. Would you intervene now or wait for glucose to rise? Let's discuss. The HOMA values. A normal HOMA, that stands for the homeostatic model assessment of insulin resistance, value is generally considered to be less than 2.5. With values between 0.5 and 1.4 often indicated as normal, while values above 2.5 suggest insulin resistance. The consequences of ignoring insulin resistance, what can be those? Type 2 diabetes will be started. By the time HbA1c hits 6.5, insulin resistance has been present for over a decade. So this is the data. MASLD and MASH. Insulin resistance is the number one cause driver of fatty liver disease, even in non-obese patients. Cardiovascular disease. High insulin promotes atherogenic dyslipidemia, that is the low HDL, high TGs, and small dense LDL. Polycystic ovarian syndrome and infertility. Insulin disrupts ovarian function and testosterone balance. The Alzheimer's, which is now called the type 3 diabetes, the insulin resistance in the brain contributes to neurodegeneration. So question for you is, what's the most overlooked consequence of insulin resistance in your practice? Please comment below. So the takeaways: practical steps for clinicians, how to diagnose and manage insulin resistance early, go beyond glucose, check fasting insulin, HOMA-IR, triglyceride glucose index. Identify early metabolic red flags, that is, high triglycerides more than 150, central obesity, fatty liver, or polycystic ovarian syndrome. Use lifestyle and pharmacology together. Strength training, intermittent fasting, GLP-1s, and metformins. Think beyond diabetes. Insulin resistance affects the liver, heart, brain, and reproductive system. Let's continue the conversation. Comment below what's your go-to first-line intervention for insulin resistance. Coming up next, MASL, the metabolic liver disease we cannot ignore. So subscribe and turn on notifications. Let's change the way we approach metabolic medicine. So thank you very much for being with me today. In the next episode, we shall be discussing MASL, the metabolic liver disease we cannot ignore. So don't miss this very important episode of our workshop on metabolic health. Till then, take care. Khuda Hafiz.